In this video, we will explore various aspects of minimal change disease, from its pathogenesis and genetic factors to diagnosis, treatment options, and impact on patients' well-being. Join us for a comprehensive understanding of this enigmatic glomerular disorder. The effacement of podocyte foot processes in minimal change disease involves disruption of the actin cytoskeleton and slit diaphragm proteins. Molecular pathways and signaling molecules regulate actin filament reorganization, leading to podocyte vulnerability. Understanding these mechanisms is crucial for treatment development. Cytokines like IL-2 and TNF-alpha play a crucial role in minimal change disease by damaging podocytes. IL-2 activates signaling pathways that disrupt actin filaments, while TNF-alpha induces podocyte apoptosis and compromises barrier function. Understanding these mechanisms can help develop targeted therapies for the disease. In this section on the genetics of minimal change disease, we will review the current understanding of genetic factors contributing to the development of this condition. We will explore potential candidate genes involved in podocyte dysfunction, cells in the kidney, and immune dysregulation. By studying these genes, we can better understand the underlying causes of minimal change disease and potentially develop personalized treatments for patients. In a video discussing biomarkers for early diagnosis and prediction of disease progression in minimal change disease, we explore the potential of urinary excretion of soluble urokinase-type plasminogen activator receptor, SUPAR, and renal tissue expression of angiopoietin-like 4, ANCL4, as emerging biomarkers. These biomarkers have shown promise in identifying patients at risk of developing minimal change disease and predicting disease severity. They have the potential to revolutionize diagnostic and prognostic approaches, allowing for personalized therapeutic strategies and timely intervention. Immunosuppressive therapy, including corticosteroids, calcineurin inhibitors, and mycophenolate mofetil, is effective in treating minimal change disease. Individualized therapy considering patient factors is important for optimal outcomes. Minimal change disease can occur in adults and is often misdiagnosed as other conditions. Differentiating between idiopathic minimal change disease and secondary causes is important for proper treatment. This can be done through a comprehensive evaluation of clinical history, tests, and imaging studies. Minimal change disease can present with atypical clinical features and overlapping histological findings, posing diagnostic challenges. Distinguishing minimal change disease from other glomerular diseases, such as focal segmental glomerulosclerosis, FSGS, membranous nephropathy, and diabetic nephropathy, is crucial for appropriate management. Evaluating clinical scenarios, analyzing histological findings, and utilizing advanced imaging techniques can aid in accurate diagnosis. Accurate differentiation of minimal change disease from other glomerular diseases not only guides treatment decisions but also influences prognosis and long-term outcomes. Minimal change disease exhibits clinical heterogeneity, and histological variations are increasingly recognized. Subtyping of minimal change disease based on clinical and histological features has been proposed to tailor therapy and predict outcomes. Subtypes such as steroid-resistant minimal change disease and steroid-dependent minimal change disease are of particular interest due to their unique characteristics and variable response to treatment. Understanding the correlations between clinical presentations and histological findings can aid in risk stratification, treatment planning, and prognostication, ultimately improving patient care and outcomes. Renal biopsy plays a critical role in the management of refractory minimal change disease. While most cases respond well to standard immunosuppressive therapy, a subset of patients may exhibit persistent or recurrent disease activity. Renal biopsy enables the identification of alternative or coexisting glomerular pathologies that may require different treatment approaches. It provides valuable information regarding the extent of glomerular involvement, immune complex deposition, and podocyte injury. The histopathological evaluation of renal tissue obtained through biopsy guides therapeutic decision-making, enabling targeted interventions and improving patient outcomes. For patients with minimal change disease who do not respond to standard immunosuppressive therapy, alternative options such as rituximab and other emerging therapies show promise. Rituximab, a monoclonal antibody targeting CD20 on B cells, has shown efficacy in inducing and maintaining remission. Rituximab-based regimens and targeted therapies are being studied for additional treatment options. Evaluating the safety, effectiveness, and long-term outcomes of these new approaches is important for treating resistant minimal change disease. Diagnostic challenges and management considerations surrounding minimal change disease in the elderly necessitate a distinct approach. Age-related changes in renal function and comorbidities can impact the clinical presentation and complicate the interpretation of diagnostic tests. Additionally, age influences the choice and dosing of immunosuppressive agents, warranting cautious therapy. Moreover, potential drug interactions and adverse effects need to be carefully considered. The individualization of management plans, incorporating the multidisciplinary approach, can optimize outcomes and ensure quality care for elderly patients with minimal change disease. Minimal change disease has not only physical but also significant psychological impact and impairs quality of life. Chronic nature, frequent relapses and medication dependency lead to distress, anxiety, depression. Holistic care should include psychosocial support, addressing psychological impact and quality of life issues. Empowering patients, enhancing coping strategies and improving well-being involves mental health professionals, patient education programs, and support groups. Recognizing and addressing psychological aspects is integral to holistic care. To conclude, minimal change disease is a fascinating glomerular disorder with many unanswered questions. By studying the intricate molecular pathways involved, identifying key cytokines and genetic factors, and exploring emerging biomarkers, we aim to improve diagnosis and treatment. Personalized medicine and a multidisciplinary approach will lead to better outcomes for patients.